Okay, that could not have come at a better time, that commercial. One of my topics is actually nvra.net. I'll take the caller now, and then we'll go back to that. Thanks for calling, and thanks for listening. How you doing?
Good. Sorry to interrupt you. I didn't mean to do that.
You're not at all. You're the reason we're doing this show, for you to help. How can I help you?
I'm not calling about myself personally.
Okay.
And I want to assure you, this has nothing to do with politics. It's just that you're a professional. And I'm very interested in getting your opinion at the present time, how this Affordable Care Act is working, and what problems you may be encountering, and how people are doing with it. If you want me to, I'll hang up and listen, or I'll do
please
whatever
stay
you
on.
say.
I love this call. How is the Affordable Care Act going? We are not allowed to say the O word. You can say it, but I'm not allowed to say the O care word. It's called PPACA, Patient Protection Affordable Care Act. It's a nightmare, a total nightmare. 62,000 plus people enrolled. It's very, very, very hard to keep telling people time and time again, be patient, be patient, be patient. My friend just got her card on Saturday. She paid in early December for this product. She just got it on Saturday. I fielded her phone call 3 to 4 times already. She paid her bill. Some people are getting their checks sent back. Some people got their checks shredded. You are lucky enough to live in the #1 state that did it right. The Access Health Connecticut is the #1 exchange in the country because the healthcare.gov was a disaster, caller. I mean, literally a disaster. They can put a man on the moon, but they couldn't build a website that would sustain the number of hits. So I give Google a lot of credit and Amazon and stuff. I mean, they're getting so much traffic and they make it look easy. But anyway, the unfortunate part about this phone call that you're calling in on right now is what I'm going to say. You are going to see rate increases like never before. My April, May, and June renewals are already coming in at 28%. My owners of businesses, I'm no longer going directly to the HR person. I'm going right to the owner and saying, what are we going to do? The 2 people this week have already told me, I'm dropping my insurance. So you're lucky enough, hopefully, to be over 65 and on Medicare, correct?
Yes, sir.
Professionally, stay where you are. Don't bounce around from Medicare Advantage to Medicare Supplement. It's such a volatile market these days. One large carrier, dropped 2,000 doctors.
Yes, I know.
Another carrier, a very good carrier out of North Haven, dropped New Haven County in general. I can say these things now because it's over, but United Healthcare dropped a lot of doctors. Anthem dropped their plan in general. The supplements, a Medicare supplement where you keep and retain original Medicare, that seems to be doing better, but it's extremely expensive. The Affordable Care Act will not affect Medicare. It will affect just under 65-year-olds. So your children, your daughter, your son,
right.
They're going to get killed. They can always go to the exchange and qualify for an advanced premium tax credit, but the tax credit is going to expire after 24 months. So please stress to them that they have to save their money. And if people don't understand that, how can you go from paying $515 a month to $200 a month for no reason? The reason it's so discounted now is based on your income. And never before have we seen rate sheets like we're seeing now, where basically from starting at age 20 up to 65, every rate every year is a different price, and every year it gets higher. So
I thought that they had help, like you just mentioned. There's help for people that couldn't afford these premium increases.
Right. But the help is a 24-month window of time.
So then when it's over, when the election is over in 2014, then all this
16
goes up.
2016, the election will be over in November 2016.
Right. Yes.
It will go more up than you can imagine. It is a pure disaster, and it's all funded with government subsidies. The millions that Connecticut is getting, that the other states are getting, is our tax dollars. I have to credit Connecticut, Anthem. They have done a great job with either their off-exchange and on-exchange plans. Connecticut, they have a solo product. Anthem has a silver, a gold, a bronze. Try not to buy the bronze. It's a stinky insurance. But they've done a good job. Aetna chose to pull out and take a wait-and-see approach. Cigna, I was on the phone with them the other day. They've chosen not to get involved. So the carriers that actually got involved, there is a third carrier. It's called Healthy CT, but they really didn't get any of the market share. They the two that did were Anthem. They won clearly, and Connecticut came in a far distant second. But they did a decent job of it, getting affordable care to people that didn't have it. Now, what you're also seeing, which is a problem, is that the older generation, the ones that didn't have insurance, that have the medical problems, they jumped on first. There's a health fair tonight at St. Mary's Hospital from 4 to 8. And don't go to a health fair. Go to an agent. The problem with the health fair is they're just so busy, they're making mistakes. Somebody's had to come to me because they got their income wrong. And the person said, I really shouldn't be getting this much of a tax credit. My insurance shouldn't be $62. Well, the person at the health fair heard $22,000 instead of $42,000, didn't even look at the tax form, and whatever the information is inputted into the exchange website is what spits out the tax credit. So yes, it did a very good thing by getting people insured. We need more younger people to get on to buoy the ship. And secondly, what we need for more physicians to get on the network. The physicians network is called Pathway X, and the network isn't as strong as we were hoping. So when people think they're getting Anthem, they're really not getting Anthem kick butt insurance. They're getting Anthem Pathway X insurance, and there is a limited network there. Lastly, I would like to stress the number one thing, and this is a positive that the Affordable Care Act did, was it did away with the pre-existing condition.
Yes.
If you had a pre-existing condition, my mother, I can pick on her because she's my idol. She died of breast cancer. She was uninsurable. So she and Lynn Ward and Frank Fulco, the late, great Frank Fulco, invented a plan called an association plan. But with the Affordable Care Act, you no longer have to own a business, join a chamber of commerce, have a group of 3. You can get guaranteed issue insurance by simply buying insurance now as of January 1st, 2014. That aspect I really do like. How about yourself? How do you feel that it was rolled out, and what's your early impression?
Well, first I'd just like to see if I can recap what you said, and you correct me. Basically, I think we both agree the intentions are good, like the pre-existing conditions. The intentions were good. Right. But from what you're telling me as a professional, other than that, there are a lot of problems arising with this. Is that a reasonable recap?
It is. So many people are getting free insurance. It's not like a few. It's tens and thousands of people getting free insurance. Who's going to pay for all the care? The doctors still need to get paid, who are my colleagues. We're professionals. I work 6 days a week. It's from 8 a.m. I got home last night. I was at an awesome senior center till 7:30. I mean, I work my butt off to be able to pay my bills. People are getting it for free. I enrolled a woman. She works at said place on Wolcott Street. And no lie, this is how she said it. That's what I'm talking about! Woo! She was so excited she got free insurance. It was called Husky D. Beautiful woman, intelligent, but low income. She was so excited. And I'm saying to myself, what am I doing wrong here? She got free insurance. I'm paying $1,895 a month for my family. So, it is a good thing, but everyone can't keep getting it for free. And what I hope it doesn't hurt are the fabulous people at the Staywell Center, because the people at the Staywell Center had it right the first time. That was a clinic. You had to go to the clinic. It was state funded, and that was well run by Don Thompson and his staff. Now that everyone's going to, not everyone, now that 33% of the people that have to pay, the 62% or 63% are getting it extremely, extremely affordable, and it's going to be a landslide of bills and claims, and I don't understand how the system's going to sustain itself.
But I'm a little confused because I thought you said premiums were going up, but now you said...
No, that's rate increases for groups. On the exchange, you bought insurance this first time, and it was pretty affordable. And you're going to go out and use it. You're going to go out and put in claims. Well, those claims still need to be paid by the carriers.
Yes.
It's going to hurt. It will hurt.
Right, yeah, of course.
I appreciate you calling me a professional, too. That was very nice of you.
Well, you are, but thank you very much for taking the call.
God bless, and have a great Wednesday. Talk to you soon.
Thank you.
All right.